I'm not sure. I think in the translation the arrow moved. Sorry about that. This is your alar ligament.
Yeah.
Okay. So you're going dens to really. It goes from dens to the occiput, and it's going up at almost the 45-degree angle, a little wider than that. The role of all ligaments in the body is to help guide movement. We rarely use ligaments to check movement. Okay? Sometimes ligaments can be energy storing, but usually it's about guiding movement. So the alar ligament is no exception. The alar ligament is going to help to guide the arthrokinematics. So if the alar ligament is ruptured or stretch lengthened, the arthrokinematics get thrown off, and that's where the risk comes in. So, St. Augustine, Stanley Parris wrote, all you need to do is this test. So you have the person sitting here, and you're going to palpate, you're going to find C1, you're going to find C2. And as I palpate, if the alar ligament were to check any kind of motion, in other words, stop any kind of motion, it could stop side bending, or it could stop rotation. So if you palpate C2 spinous process and you side bend, you should feel the spinous process of C2 wag opposite. Right? That's not new to you guys. Right? You side bend to the right, you feel the spinous process, immediately go to the left. You side bend left, you feel the spinous process, immediately go to the right. Those are normal arthrokinematics. The test for alar is that, but it's a test of immediacy. If there is a delay in the tail wag, the thought is that the alar ligament is compromised.
How do you quantify delay?
What's that?
How do you know if there's a delay about it?
How do you know?
Feeling lots of people's necks. No, I'm serious.
Right.
That's how you know anything's
Right.
Right. So, it's a test of immediacy. You want to feel it move into your hand right away. Okay? There are other groups that will stress test the alar ligament. And you stress test the alar ligament similar to the way you would stress test any other ligament in the body. You put the ligament on tension, and then you apply a little overpressure, feeling for a firm end feel. Okay? So we're going to do that one as well. But right now, do your test of immediacy. So, practice. Palpate neutral. So the rule is, you have to be able to check, the alar has to be able to check the motion in either neutral, flexion, or extension. Right? So, if someone is positive in neutral, there's a delay. Go to flexion and recheck. Oh, he's okay.
Aww.
You go to extension. And he's actually a little limited in extension.
Did everyone say just aw?
You know, you wanted it. So when you feel it in neutral, and then CD flex a little, check it, same thing, and then extend. So it should have an immediate reaction in one of the three places. And if it does, then you're okay.
So if in all three there is no...
Stanley Parris says that it qualifies as a stress test because you can figure out if something is compromised. But a stress test requires stress. So you want to stress the ligament. So the other way you can do the stress test, if you palpate and you stabilize C2. So you get a hold of C2, okay, and then you side bend. The alar ligament should check side bending. Okay, so now I'm doing the same thing, but now I'm stopping C2 from moving. So that when I side bend him, I'm getting a sense of that ligament. I'm getting the tension on the ligament. And then you switch, and you say, okay, palpating here. You're stopping it from moving. You're holding C2, and then you're side bending. Slide down a little bit. You want him to be somewhat in neutral. Okay, so I'm supporting the rest of him because he was knocking too back into extension. I couldn't get a sense of it. Stabilize C2, I side bend, and that's a firm end feel right there. So I'm holding on C2, and then I'm just doing a straight side bend. It's a non-physiological side bend. I'm just doing that and checking the motion. I'm not allowing for the arthrokinematic glide. I'm just stopping C2 from moving. I'm stopping the tail wag from happening. Everybody understand that? And I'm holding around the articular pillars and squeezing the spinous process. So I'm stopping the whole segment from moving. Yes, I'm stopping the tail wag. I'm stopping the spinous process. Now I'm on the left articular pillar. I do this. That's his end range, and that's a check. You see that? Can't get him anymore. That's a ligament end feel. I go over here. Not getting one. So, what did I say? Flex. Okay, let's see. Uh-oh. We have one in extension. All right, so we have a little bit of a. You're okay. You can continue. It's an anomalous alar. So might that have an impact on arthrokinematics? I don't know. Maybe. But in sitting, he felt positive. He felt positive in all three directions on the right side. I get him here and I do neutral and I'm looking for the end feel. Not quite getting it. I flexed him because that's usually where you're going to get him. I'm getting a joint jamming. I'm actually not getting a ligamentous end feel. There's a little bit of a lack of a C1 slide. So I bring him to extension. And that's it right there.
Should his lips be turning blue?
Yeah. Oh yeah, that's a good point. That's the other thing you're supposed to do. So you want to watch it. These days are too long. So you want to watch them because if you're getting that laxity and you're not getting to an end range and you are starting to actually torque things and you're starting to get a vertebral artery response, you can see it in their eyes or you start to see, keep them talking and that kind of thing. With all stress tests, you're supposed to be doing that, watching their eyes. Okay?
So he's not positive.
So he's not positive.
But what is it?
No, but we have to look to find his.
What does it mean to be positive 2 out of 3 though? Is it?
No, you just have to check in one.
Yeah.
So practice that. So your patient lies down, throw a pillow under the head. But my intention is that.
So can you describe where your hands?
So this is the C2 spinous process right there. So my hands here are on the back of the transverse process, the articular pillars, and the SP is right here. I hold the head, and I'm going to side bend the head to the right. He's looking up. I side bend to the right, and I'm going to check this so that's going to stop. The alar ligament's going to pull in the dens as I do this. It's almost as if I'm doing this to C2, but I'm not. That's my intention, and then I move from above, and that's where the.
So you're not actually blocking the spinous process, but you're blocking it through the transverse processes. Or the,
Well, because you have the SP there, so yeah, you're blocking the spinous process, but you're doing it through the articular pillar.
pillar. I didn't know you're on a pillar and not the transverse process.
So the articular pillar kind of is a transverse process. So you find a transverse process, don't go out to the points, drop behind it, and you're on the articular pillar.
Thank you.